Due to the inherent characteristics associated with the disorder, students with ASD can also be some of the most challenging students to teach in the classroom. Teaching and supporting students with an ASD can pose significant challenges to teachers, since it's a spectrum disorder that affects individuals in many different ways. The challenging characteristics of students with an ASD make specific interventions and supports necessary. We're going to cover strategies and interventions that are evidence-based practices, meaning that there is research supporting the use of these strategies when supporting a student with an autism spectrum disorder. So, what exactly is an evidence-based practice? To be considered an evidence-based practice, the effectiveness of the intervention must be established through peer-reviewed research in scientific journals. The use of research-supported treatments in education is supported by both No Child Left Behind as well as IDEA. There are professional organizations that have identified evidence-based practices that are supported by research in the field of autism spectrum disorders. The National Professional Development Center on ASDs has identified 24 evidence-based practices. On their website, they provide briefs for each of the evidence-based practices. These briefs include a step-by-step implementation guide, an implementation checklist, and a reference list containing the research background. Additionally, the National Autism Center has identified 11 effective treatments through the National Standards Project. Let's take a look at some strategies: prompting, task analysis, visual supports like schedules, social narratives, structured work systems, self-monitoring, and PECS, or the Picture Exchange Communication System, are all identified as evidence-based practices. Using the evidence-based practice briefs from the National Professional Development Center may help you further your understanding and use of these evidence-based practices, along with giving you ideas of how they could be implemented as interventions in your classroom. These are practices that have been proven effective through research. Oftentimes, as a teacher, you will be approached by parents or other professionals who ask you to try a strategy that may be unfamiliar to you. Or a parent may come to you and tell you that they have been using a strategy that you know is not supported by research and potentially could be considered unsafe and even unethical. Sometimes parents use resources that are available to them, such as the internet, and they have read stories of treatments that have fixed or cured a child, and may begin experimentation in hopes of similar results for their own child. This is done out of desperation and the desire to want to try anything to fix their child, because we all want the best for our children. How would you respond to that parent? We want you to be prepared to share tools with others that are known to be effective, that have a strong body of research supporting their use. We also want you to be able to respond confidently and be able to give resources to the parent that says they're going to try secretin because it may improve behavior and gut or digestion issues, but you know this treatment is not a practice that is supported by research. So as a teacher, it's important that the students and individuals we are supporting get the best services available and possible. So it's important to keep your knowledge up to date and have resources to share on the strategies that have research supporting their use. Research findings are essential, but not the only component of evidence-based practices. Professional judgment and data-based decision-making regarding the practices that you use in the classroom are key. Professional judgment includes your experience working with children with ASD and your awareness and understanding of the interventions that have been effective in the past. Knowing what is effective for one student with autism may not be effective with another student with autism, and we need to use our knowledge of what is effective for each individual. One student may be successful using a whole class schedule that is posted in the room, while another student may need an individual portable schedule, while yet another may need a schedule broken down even further into mini schedules and task organizers. Whatever intervention or strategy you're using, always keep in mind what each child responds to best and try to meet their needs accordingly. What are some strategies that we can put in place to support a student? Effective communication is not just spoken language, but it's behavior, body language, facial expressions, and much more. There are many ways effective communication can be ineffective. Children with autism struggle with social interactions and communication. Children with ASD may experience difficulties in expressive, receptive, and pragmatic language. These difficulties can often lead to the child using their behavior to communicate. Some children on the autism spectrum may have limited verbal abilities, or they may be considered nonverbal. That doesn't mean, however, that they do not have communication. Remember, just because somebody doesn't talk does not mean that they cannot communicate. The nonverbal child will communicate using non-symbolic behaviors such as pointing, gestures, and pulling a communication partner towards a desired object. It's very important to establish an effective communication system for a student with autism. This system should be universal so that anyone working with the student can understand and operate it. It should also be portable and should move with the child from setting to setting. Communication systems can be high-tech, such as a speech-generating app on an iPad, or low-tech, such as a communication book made in a 3-ring binder. Think of all the visual strategies we use on a regular basis. How many of you write grocery lists before headed to the store? How about those to-do lists to make sure that we accomplish everything in our day? What about road signs? How would you do if all you had to rely on was the voice coming out of your GPS, but no signs directing you where to go? It's easy to forget how much we rely on those visual strategies every day. Now think of a student with autism. Most students with ASD are visual learners. Visual strategies and environmental supports make auditory information or expectations and place them into a visual picture for the child to understand. There are many different types of visuals and environmental supports that are considered effective. These include, but they're not limited to, visual schedules, calendars, task organizers, and visual behavior management systems. They can also include visually based environmental supports such as labels, boundaries, and color coding. The most important concept to remember when incorporating visuals into the classroom is to actually teach the child how to use them. For instance, a child can be in a room that is organized through color coding, taped boundary settings, and that uses a visual schedule, as well as a task organizer. But if a child doesn't know what any of this means, it's probably not going to be too effective. Does using visual strategies mean that you cannot talk? Of course not. However, it is important to remember not to talk too much. Have you ever seen the Peanuts cartoon with Charlie Brown's teachers? All the students ever hear is wah, 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 all day. How many of you ever felt like that in school? Now consider a student with autism. The auditory system is their weakest processing channel. Students with ASD have an extremely difficult time processing auditory input and can often become frustrated or confused when they do not understand what is being expected of them. So, what can you say? Only include what is necessary. The who, the what, when, and where is a good place to start. Using short sentences or one-word directions and pair them with a visual cue. How many of you use a schedule, a planner, or the calendar on your phone? For many people, including myself, life would seem pretty chaotic without knowing what we have to do and when we have to do it. Schedules can be just written information, or you can include pictures. The format of the schedule is based upon the child's individual needs. The picture can be hand-drawn, icons, colored icons, or digital pictures. The internet is a great resource for locating pictures. You can find just about anything you need. Schedules provide routine and predictability and allow the child to be more independent throughout their day. When students know what to expect and can move through their day with an increased independence, it decreases their stress and anxiety. Post schedules on the wall, place it on a student's desk, or attach it to something portable. The child should have access to a daily schedule at all times. Even if the student begins to demonstrate independence using their daily schedule, it does not mean that the use of a schedule should be discontinued. Using a schedule should be considered a lifelong support. The format of the schedule may change over time, but the continued use of one will help students navigate their days, both in school and in future settings. Self-stimulatory behavior serves a purpose for everyone. The two main purposes of self-stimulatory behavior are calming or alerting. Oftentimes, self-stimulatory behavior is viewed as negative behavior or something to get rid of. Self-stimulatory behavior should never be extinguished. Instead, it should be shaped if necessary, and it should be given a time and a place. Because the self-stimulatory behavior serves a purpose, if the behavior is extinguished, the child will find another behavior to try to replace it. Reward the child for making the more appropriate choice. Changes will not happen overnight, and you may have to search out and try lots of different replacement behaviors. For some behaviors, replacements may not be an option. You may have to carve out a time and location and put it into the child's schedule. If you are thinking about setting up a sensory room in your home or classroom, spend some time observing the child. If your child loves to jump or skip, consider a mini trampoline. If he likes to spin, consider a swing or a sit and spin. It may also be necessary to have an occupational therapist with expertise in sensory processing perform an evaluation to determine the best items to meet their sensory needs. Think about going to work or going to school every day. What is your reinforcement? I think most people would say, for work, it would be your paycheck. We are reinforced to do what is expected of us by receiving our paycheck every week or two. Think along the same lines when it comes to students. Reinforcing appropriate choices may increase the likelihood of a student to continue demonstrating behaviors. When students know what they are working for a desired outcome, it can provide a little oomph to get the job done. To know what will be reinforcing to your student, you need to complete a reinforcer preference assessment. This will give you an idea of what kind of goodies and rewards to stack up on. And let me tell you, you may be surprised at what some students like for reinforcement. Once you know which reinforcers that you will use, make sure to set clear expectations so that the student will know what they need to do in order to receive their reinforcer. Can you imagine life without choices? Would you appreciate being told what to eat, what to wear, what TV shows to watch, who to spend your time with? It seems like it would be pretty frustrating, huh? Sometimes it's too easy for a teacher or a parent to make choices for a child with an ASD. Although well-intended, the child may know perfectly well what they want and when they want it. Think of the frustration they might feel if all of their choices are being made for them. For the child with autism, their frustration is often seen through their behaviors, such as dropping to the floor in the hallway of school, having a complete meltdown wherever they may choose, or simply refusing to complete a task or respond to anyone in the environment. Oftentimes, simply providing the child with choices may eliminate some of the inappropriate behavior you may see. Additionally, choice-making opportunities may serve as motivation to complete their work and respond appropriately to requests. Now that we've gone over some strategies that contribute to successful and effective programming for students with autism, here are some final thoughts to take with you. It's important to use both evidence-based practices and promising practices in your classroom. Use what you know about your students, information from research, and data to make decisions regarding what will work for each of your students. Be patient. Change takes time. Don't expect miracles to happen overnight and have a perfect classroom with just a blink of an eye. Always be persistent. Don't give up. Just try and then try again. Just because one strategy doesn't work doesn't mean the next one won't. Be flexible and be ready to adapt to meet your students' needs. Remember that your child in each of your classes will have their own unique needs.